Okay, we're going to enter into the urinary system at this point. And so the first thing we're going to do is we're going to look at our kidneys. So these are the kidneys on both sides. I'm going to cut the connective tissue. Now remember, we have true coelom, so everything's divided into cavities here. And I want to go really superficial. If you're not comfortable using a scalpel, I would suggest just using a blunt object to remove that connective tissue. We don't want to cut into the kidneys, and we don't want to damage the stuff around them. We just want to see the kidneys, and then we can pop that out of the sac. Pretty cool, right? So on this side, we're just opening that up, moving that connective tissue. Blunt dissection is good dissection. You're doing less damage. And then we can open these up. Oh, shoot. And so one thing that's really cool is we start dissecting this out, and I start going kind of a little faster. I started to expose 3 tubes, especially right here. 1, this is our umbilical cord. 2, we have a artery supply coming in. And then this little guy right here, that I just removed out. I'll get it on the other kidney. That is going to be what we know. That will connect to our uterus. And so that's really kind of important to know that we have those uterine tubes, because they're going to connect to our uterus. And then we can urinate, which is really kind of important. So I'm going to clean some of this up a little bit. I can see right here, that is beautiful. And I just removed it, so I can get this in focus. That right there, that little thing, super important. That's an ovary. That ovary was connected right here to the ovarian tube, which will come down, and it's right underneath here. So here's my other ovary. It's connected to the fallopian tube, and this connects right here to the uterus. So I'm going to cut this umbilical cord out of the way just a second to expose that uterus. Now remember, the umbilical cord's there to give nutrients to mommy, from mommy to baby, and this little girl is not ready to have her own. This little Y-shaped connection right here, that is our uterus. Get a little bit closer. We can see that's the uterus. Here is the connected ovary, and this is the fallopian tube. If we come up here just a little bit more, this is connective tissue I'm removing from the kidney, and this is the uterus right here. That will go to the urethra, which is connected to our bladder. Our bladder is down just a little bit further. And is usually a ball-like sac. And they're flattened right now because these guys haven't had their first bowel movement. And so they're still connected to the umbilical cord. Aha! Right here, bottom side. That is our bladder. But let's look at one of these kidneys. So, by the way, I could follow this tube down, and this will connect to my bladder. Beautiful. So we're going to just cut this kidney in half so you can see in there. Kidneys are filtering that blood system. Really important. You can see how dense this is. Get into focus. Perfect. And so we can see this membrane, how dense it is, and it's actually exchanging, so it's actually filtering blood through there, allowing for it to remove any waste products, salts, extra things like that into there. So since we've exposed our little female, we're going to go look at our thoracic cavity. Remember, the thoracic cavity is anterior, not posterior, to the abdominal cavity. And so we're going to remove some of this stuff. I'm removing it from medial to lateral. I am not going through the bone. So that's one thing that's different about a dissection for the thoracic cavity is because we have bone there. And that bone allows us to have a little break in there. So now that I have that exposed, here's what I'm going to do with scissors. We can see the ribs here and the sternum. I can feel the sternum. I'm going to go slightly to one side of the sternum and cut up. I'm cutting through the ribs. Luckily, they're not very strong because, well, they haven't developed full into bone yet. Still kind of cartilage, like so they can come out. Because remember, these guys give a placental birth, so they need to come out. So from here, we can separate the connective tissue. And note this right here. Get that so we can see it just a little bit better. That's the diaphragm. That muscle separates our abdominal cavity from our thoracic cavity. Nice little separation there. From here, I can open this up. I'm breaking in my ribs, so I can open it. They're very pliable. Now that I said this is a fetal pig, it's fully developed. It looks like it's almost ready to give birth, but here's how I know it's a fetal pig. The lobes are broken up into the lungs are broken up into multiple lobes. So I'm going to cut a lobe off. And what we can see in this lobe is little airways, little holes going through it. Here's what we do know. This is just plain water, right? If I put a piece of lung in there, it will sink to the bottom if there's no oxygen in it. And that's because if there's oxygen in there, the alveoli are full of air, which make it less dense than water. And if this pig had taken its first breath, those lungs would float. We'll try that with the cat or minks, whichever we have. From there, we're going to see the heart. Our heart is here. It's located within a sac that I already removed accidentally. It's called the pericardium. That's to prevent any damage from there. We can see the atria on the top, the ventricles are on the bottom. It's a 4-chambered heart, very similar to ours. In fact, pig is used for fixing the human heart. A couple things as we go into our throat here. We need to expose some things. I'm using a little bit of blunt dissection right now because I don't want to ruin some of the beautiful anatomy that's in here. And this will just separate out. So I'm just taking my finger, going on each side, and separating out the anatomy. I do not want to use my scalpel because I'll damage some important things here. So a couple things that we can start to see with this throat. Here is your voice box, your larynx. We have lymph nodes and glands. You have your trachea, which is here. I can tell because it's ribbed and has cartilage, and underneath that is a tube called the esophagus, and that's right there. They're actually connected. You can see past that to the spinal cord, and then right here, that's your jugular. So this goes all the way up into the brain and delivers oxygen to the cranial cavity. Really important that we can see those, understanding that vocal cord. Now I'm going to take out the vocal cord because I think it is just so neat. So we start talking about our larynx and our vocal cords. So I'm going to cut the bottom of the trachea. I'm going to try to go just above here. So I'm going to take it out. And there's some right here. So this is your vocal cord here. You can actually feel the cartilage in there, so that's your vocal cord. There's your trachea. Your larynx is up top, right there. Really nice. And so there are folds in this, and those folds will allow for you to create sound. And then we have a gland that's right here. This gland is called the thyroid, which helps with metabolic processes. And so it's really important to know that that's what we have from there. And then what we have left, we can see on both sides here. I'll move it up just a little bit so you can see that better. We can see arteries and veins running on both sides. Part of your lymphatic system here. These lymph nodes are really important. When you get sick, they actually swell up. So we can feel our lymph nodes in our throat, or a doctor feels them. We also will have them through our abdominal cavity, in our groin, and in our armpits. Are the places that they're most common with. And that, ladies and gentlemen, if you're watching, is a dissection of a fetal pig.